And we have our next speaker online, Varun Dwaraka from TruDiagnostics. Are you there?
Yes, I am. Thank you.
Can you see us?
Yes, yes.
And we cannot see you. Now we see you. So you can go ahead whenever you're ready.
Well, thank you. First of all, thank you to the ARDD organizers for organizing such an incredible event. I wish I could be there, but alas, I'm here in Lexington, Kentucky. But with that said, we at TruDiagnostic would like to speak a little bit about some of the new Epigenetic Insights from 2022 and a kind of the beginnings of this multi-omic trained biological age predictor. And as mentioned, I am Varun Dwaraka, and I serve as the head of bioinformatics here at TruDiagnostic. So the talking points for this presentation really are kind of to introduce the company, the TruDiagnostic, and really looking at epigenetic aging and its clinical applications that we've been really focusing on and studying and being able to see how we can integrate epigenetic aging in these clinical settings. We'll have two case studies where we've started to do some of these investigations of the utility of epigenetic clocks in interventions and clinical outcome prediction. But really, what is kind of the cream of the crop and what we really have been excited about is going into this next generation of clocks, which integrate multi-omics. And so a little bit about us. So TruDiagnostic started in July of 2020, and since that time, we've tested over 13,000 patients in that time with multi-omic covariates. As of now, I think we have about 20,000 with those covariate information. And really, a lot of this is done through our 30 institutional research board approved clinical trials. On top of that, we also have a commercial test which allows us to be able to gather such incredible amounts of data. And this could not be possible if we did not have our 20,000 square foot CLIA lab, which contains custom aging and imprintome arrays, which really allows us to generate the data really quickly and also move over to the data analytics side. And speaking of data analytics, this has allowed us to create custom deconvolution algorithms, telomere estimators, mitotic clocks, and what we'll kind of speak about a little bit later is these multi-omic age clocks. And we really can't do this without a lot of that collaborative research with top epigenetic research institutes, some of which are listed here. And so I think it is important to, when we start to talk about epigenetic clocks, really give a primer into the history of why epigenetic clocks have been so exciting in their utility. We've known the effect of aging on DNA methylation since 1960, and it's been shown that millions of 28 million CpG sites change with age. But DNA methylation also shows significant associations, especially in these two early articles which Stephen Horvath was associated with. In the Brockland 2011, they were able to identify 3 different CpGs that really were able to calculate age within about a 5-year chronological age range. And then this was refined later with the multi-tissue Horvath clock, which was published in 2013. And it is under this framework that biological age clocks have been built using blood tissue, allowing for these measures to easily integrate into a simple blood test. And since that time, various generations of clocks are now present, which include your first generation clocks, which really represent those chronological epigenetic age clocks, which are highly useful for really getting those precise forensic age calculations, but also for those second generation clocks and beyond, which integrate that biological effect, which has been very useful in looking at the aging phenotype, disease-specific, cell-specific effects, and so on and so forth. To give kind of examples of each of these generations, we can really look into the different chronological and biological age clocks in this fantastic review. As mentioned, the Horvath clock and the Hannum clock really represent some of those popular representatives of that first generation, where those CpG sites that were selected were based on that chronological age of those samples. Moving over to the biological clock side, what we are able to see is that the pheno-age clock and the Grimm-age clock are one of those, or two of those excellent examples, along with the telomere-based, DNA methylation-based telomere estimator, which really look at those aging phenotypes a little bit clearer. And to really kind of show the distinction between the two different generations here, what we can look at GrimAge as a perfect example, where they were able to develop DNA methylation-based surrogates for plasma proteins and smoking pack years to create that that surrogate marker. And then using that surrogate along with age and gender, we're able to regress to time till death and identify those CPGs that really explain that phenomenon, and is ultimately creating that time to death clock and predictor that GrimAge is very known to be. But more recently, we've been kind of going into more of those third generation clocks, which are really trained using aging phenotypes, but also longitudinal information. For instance, the Dunedin-Pace clock, which was published in Belsky et al. 2022, followed a cohort of 1,037 individuals from birth to about 45 years of age, and collected a series of health covariates across multiple systems. This included your cardiovascular, metabolic, renal, hepatic, immune, dental, and pulmonary systems. And using this information back in their 2017 paper, they were able to use this to generate an instantaneous pace of aging score, which allowed you to identify a pace of aging at the time of blood collection. In their Dunedin-Pace paper, in POAM paper, the 2020 paper, what they were able to do is create a simple blood test by regressing this pace of aging against methylation data to identify CPGs that were highly correlative. And what this provided was essentially a quick and easy blood test, which allows you to understand the instantaneous rate of aging of a sample that was collected, and not an age that's based on historical information, but at the time of collection, to really show you how you are aging at the time of collection. But what is important, and I think it was beautifully shown in this paper by Morgan Levine and the rest of the lab, is how do we compare these clocks? What are the similarities and differences? And what they were able to do is, using about 5,717 CPGs that are common across all of these different algorithms and clock estimators, what they were able to show is that they were grouping them into multiple various color modules, where each of the modules represented similar CPGs that were associated with similar biological processes. And what was interesting to note is that a lot of the first generation clocks that were built off of chronological age were picking out CPGs that were associated not only to similar biological processes, but similar proportions were associated as well. And this was kind of followed up again with second generation. However, when we start to look more into some of the generations across, the best example here would be GrimAge and Dunedin-Pace, which represent the second and third generation. What you'll see is there's also similarity in those CPGs as well, but the difference really exists in how much of that percentage or how much of that signal is being identified. And so, really going into understanding how these clocks tick are going to be very crucial as we move forward into understanding how we can use them in the clinical setting. And with that said, I think it is important to go into understanding the association of how we can use epigenetic age clocks to associate them to disease and interventions. And luckily, some of the work has already been started by many esteemed researchers in this area. In this review, I think it does a very good job of kind of showing these historical clocks, such as the Hannum clock, the PhenoAge clock, and GrimAge clock, to their reported associations of disease and other health covariates, if you will. For instance, the DNA MAge, which was based off of the original clock by Brockland et al., really showed associations to those chronological ages. And this is also more recently with the Zhang age predictor, which is also associated with chronological age. However, going back to that whole idea of the second generation of clocks, PhenoAge and GrimAge show not only a association to chronological age, but more to some of these all-cause and cause-specific mortality, survival, count of comorbidities, or even into cognitive decline, and so on and so forth. And so it is important to consider that each algorithm shows statistical significances to various disease outcomes, and it is important to acknowledge that each clock can serve a different purpose in the clinical setting. This review by Justice and Krzyzewski in 2020 really represents what we look for in a lot of some of these clocks. So many existing clocks have been shown utility in clinical trials associated with chronological age in independent cohorts, and can predict age-related change in function, chronic disease, or death. However, we need to move more into the investigations to study their utility on understanding how certain interventions reflect upon aging as well. And this has been started a little bit with Dunedin Pace, where really Dunedin Pace exhibits sensitivity to show aging changes in validated treatments such as caloric restriction. For instance, in this preprint by Waziri et al. 2011, what they're able to show is that comparing a cohort of individuals that are ad libitum consuming calories versus those individuals undergoing caloric restriction, it had, compared to most other clocks such as the Horvath, Hannum, PhenoAge, and GrimAge, what is interesting to show is that Dunedin Pace actually showed a validated change where the caloric restricted individuals are undergoing a lower pace of age versus those that are consuming calories ad libitum. Similarly, there is a response to disease state which is being picked up by Dunedin Pace as well, which is shown on the rightmost panel right here. However, it is important to acknowledge that some diagnoses such as normal cognition and MCI were somewhat consistent between GrimAge and Dunedin Pace. However, the sensitivity to being able to detect that difference was a lot higher in Dunedin Pace. Finally, it is important to understand that association to health risk. And in the original in the 2022 paper, what they were able to show is looking at mortality, CVD, and stroke. Dunedin Pace had a significant incidence to mortality, CVD diagnoses, and stroke in the Dunedin Pace. It has to be acknowledged, though, that this was also replicated with the GrimAge clock, suggesting that these two clocks, because possibly that they share many of the same modules of CPGs and those same signatures, are able to show the same kind of hazard ratio incidence in those two clocks relative to, let's say, the Hannum or even Horvath clock as well. And finally, what is important with a lot of these clinical trials and interventions is this ability to be able to increase that test to retest reliability. And so higher interclass correlation values in epigenetic clocks mean that there is less variation between tests, which is crucial when trying to look at test and retest reliability in using these clocks in the clinical setting. And luckily, this has been answered by with the Dunedin Pace and some of these PC corrected clocks that were published by Higgins Chen and the other folks at the Morgan Levine lab. And these two papers are a must read, and I highly recommend taking a look at them when you have a chance. So with that said, at TruDiagnostic, through collaborations, we have been able to look at some of these associations of these epigenetic ages in these clinical investigations. And so we wanted to introduce this first case study where we were able to look at the association of surgery outcome. So currently, many current clinical predictors of surgery outcome incorporate chronological age in many of their scores. This includes your Charlson Comorbidity Index and other scores associated with surgery frailty and so on and so forth. However, it might be interesting to maybe epigenetic age may prove to be more informative. And currently, there are no risk stratification tools that integrate markers of cellular aging. So it is important to determine the optimal aging biomarkers to include in risk assessment models in the future preoperative risk assessment. So essentially, the goal of this project was to assess the utility of epigenetic clocks and telomere length in evaluating their association to several clinical outcome covariates. This includes your CCI, frailty, disability, and post-operative complications. And in these forest plots that are being shown, what is interesting is that the one clock that really shows a degree of separation or high magnitude of odds of the odds ratio is indicated by Dunedin Pace, which is being shown for your 90-day complication, your frailty indexes, your ODI score, and SRS score. And so of all the clocks that we assessed, Dunedin Pace shows significant associations to current clinical outcome covariates assessed. But it has to be acknowledged that this wasn't only shown in Dunedin Pace. to a lesser extent, DNA methylation-based estimation of telomere length, DNA MTL, and the Blackburn method of telomere estimation shows significant associations to some of frailty and SRS. And I think it's really exemplified in this next figure, where when just looking at a correlation between Dunedin pace and some of these current frailty scores, Dunedin pace shows significant correlation to those current clinical outcomes, which suggests that it is a very it might be a good it might be a good tool to integrate into some of these current outcome covariates. However, one thing to acknowledge, though, is that not all of these clinical covariates showed an association to Dunedin pace. For instance, when we look at the Charlson Comorbidity Index, which integrates chronological age into its calculation, many of the chronological age clocks showed significant associations to higher CCI or higher pre-op essentially failure. Whereas there was no association between Dunedin pace and any of the different stratified CCI scores moving forward. And so ultimately, some of the preliminary conclusions, and this, while the abstract for this has been published, we are still working on the paper as of now. What it's being shown is that epigenetic clocks show significant correlations to clinical outcome covariates, especially when we consider the third generation Dunedin pace clock, which shows significant associations to frailty scores, spinal cord surgery success, 90-day complication, and disability scores such as ODI. And this was seen to a lesser extent with telomere-based metrics as well. Interestingly, CCI, which incorporates chronological age into its score calculation, showed significant associations to all clocks except for Dunedin pace and the Blackburn telomere-based estimator, which makes sense, especially when you consider that a chronological age is a huge component of that CCI calculation. And even though this was limited by a cohort size of about 86, what it really shows is that epigenetic clocks could be integrated into current risk calculators, especially in spinal surgery outcome, and provides a basis for utilizing these as utilizing epigenetic clocks for the purpose of looking at surgery outcome. In our second case study, I'll go through this a little bit quickly, but essentially we wanted to look at the hallmarks of aging, looking at cellular senescence, which has been a large focus of therapeutic studies. And what we essentially wanted to do here was, using a senolytic drug such as dasatinib and quercetin, what was the epigenetic age response here? And ultimately, kind of glossing over this, I apologize for that. The findings really were showing that epigenetic clocks are showing varied outputs in their response to senolytic treatments. For instance, the first generation of clocks, such as the Horvath, Hannum, and the neural net-based Ultimage, show increases and then decreases between different time points. We surveyed the time month 0 to 3, and then month 3 to 6 after dasatinib and quercetin treatment, and really showing that these generation 1 clocks are showing those showing sensitivity to this dasatinib and quercetin trial. RMH showed an overall increase in epigenetic age, whereas Dunedin pace showed no significant changes. I apologize for going through this a little quickly. We are writing this manuscript, and if there are any questions about this study, please feel free to reach out. But lastly, what is really important here is, where do we go from here? And this is where we are looking into developing an epigenetic clock which incorporates a multi-omic approach. A lot of the basis for this really came from looking at the GrimAge and Dunedin pace metrics, where they included a lot of these health covariates and plasma proteins. However, in this modern day age, we have a compendium of phenomic, metabolic, proteomic, transcriptomics, epigenomics, and genomic information. And rather than using a focused rather than just using focused known markers, why not use an unbiased methodology to really understand this aging phenotype from things we may not have considered? And therefore, in partnership with Brigham and Women's Hospital and Seer Inc., we've been integrating phenomic, metabolic, and unbiased proteomic technologies to develop a clock that that is guided by a score of phenotypic aging and not just chronological age. And we have already started this. We've collected about 1,500 individuals, patients here, and therefore here are some of the outputs here. And so with that said, thank you for everyone at ARDD for allowing us to have a platform to speak, connect with us. Some of the information's here, and thank you again for all your patience and consideration. Thank you.
Thank you so much, Varun. We don't have time for questions, unfortunately, but if people have questions, put them on Slack, and then Varun can go on Slack and answer them. We have to move on. But thank you so much, Varun. That was a really fantastic presentation.
Thank you.